I'm Laura Strom, a trauma and disabilities mental health specialist, and I'd like to talk to you today about post-traumatic stress disorder, or as it's more popularly called, PTSD. What I want you to know about PTSD is that it's treatable, and it responds extremely well to treatment. It generally worsens over time, and so it's important to get help. I'm very passionate about treatment for children. There was a large, important study called the Adverse Childhood Experiences Study, or ACE study. And from that study, we learned that when kids experience a variety of adverse childhood experiences, it has extremely negative consequences for their long-term physical health. So it's very important that children receive treatment. I'm also passionate and concerned about veterans receiving treatment. In fact, there's a movement to change the name to just post-traumatic stress and drop the term disorder because it's stigmatizing to our returning soldiers, and actually the symptoms of PTSD are a natural coping mechanism for a very unnatural situation. I want to talk about what constitutes a PTSD diagnosis. So the first criteria is that there has to have been either an experience of either a death or a serious injury or sexual violence. And that has to be either experienced personally or witnessed, or could be that it happens to someone to whom you're very close. Kids sometimes get it from seeing their parents engaged in domestic violence. And certainly our first responders are exposed to a variety of very traumatizing images in their work. So there are 4 symptom categories for PTSD, and the first one is called re-experiencing. So in this category, intrusive thoughts come to you unbidden. As you're going about your day, suddenly you get a horrible image in your mind of the trauma and or some aspect of it. And another way that you might experience intrusive thoughts is through nightmares. And certainly, we've all heard of the flashback. Flashback can be a small amount of feeling like you're in the traumatic event, or it can be out and out feeling like the event is happening all over again. When kids engage in traumatic play where they're acting out the trauma over and over, this is a sign that a child needs help processing the trauma. The next set of symptoms is called hyperarousal and hypervigilance. This is where people are jumpy, they are always on guard, they can't sit with their back to the door, and because of this, they often have memory problems. They sometimes have trouble concentrating. They're using all that energy for being hyper aroused, and so as a result, they're kind of easily irritated, and they may kind of have angry outbursts that wouldn't be typical of them. My boss at Stanford, Dr. Victor Carrion, used to say, avoidance is the hallmark of PTSD. And so this symptom is people avoiding any people, places, or things that remind them of the stressful event or trauma. The last category is called negative cognitions. And with this, a trauma changes your whole worldview. And after the trauma, you may start to interpret things through a negative lens or negative bias. So a person might think, well, today was a pretty good day, but I'm sure it's not going to last. Or the world is a dangerous place, and I can't trust anyone. People sometimes don't remember important parts of the trauma. Sometimes they feel detached, or like they're standing outside their body and kind of watching themselves interact and not really connecting with anybody or being present. Sometimes it's hard to even have emotions at all, including love, joy. And instead, people get a very healthy, huge dose of guilt and shame that's not necessarily deserved. I offer Stanford Q-centered therapy in my practice for trauma. It's a 15 to 18 session intervention. It's a type of trauma-focused cognitive behavioral therapy. It's evidence-based. And I was one of 2 therapists to work in a 3-year clinical research trial testing it with children. We had great results, and the kids in our study had a 65% drop in post-traumatic symptoms by the 4th or 5th session, certainly by the midpoint. I came to really appreciate assessing and assessments as part of trauma treatment as a result. And so I assess all adults that come into my practice, and certainly children, but I assess adults by looking at anxiety, depression, sleep, how's a person sleeping, substance use, and post-traumatic symptoms. I used level 2 assessment measures from the DSM-5 website. There's another assessment I really like called the Life Events Checklist. It's on the Veterans Administration website, and it's invaluable. Another evidence-based treatment that I offer in my practice is eye movement desensitization and reprocessing therapy, or EMDR therapy. And this is a really powerful treatment, and it's often offered to our returning soldiers and offered at many VA clinics. It's a way of using bilateral stimulation to desensitize painful memories. To learn more about this powerful treatment for trauma, please visit either my website, lauracstrom.com, or emdr.com. For me as a mental health clinician, it feels great to offer 2 excellent treatments for post-traumatic stress disorder. And treatment absolutely helps, and life can get much better. Thank you.